If you've been told the only thing left to do is take out all your teeth and give you a denture, I want you to stop and listen carefully, because that advice has cost more people their confidence, their comfort, and their quality of life than almost anything else in modern dentistry. And in most cases, it's not even true. In the next few minutes, I'm going to show you what dentures actually do to your mouth over time, why they're still being offered as the default, and what your real options look like in 2026. By the end, you know exactly what questions to ask before anyone takes a single tooth out of your mouth. So you walked into a dental practice, worried about your teeth, and you walked out being told the simplest solution is to take them all out and give you a denture. It felt rushed, it felt final, and something in your gut said, there's got to be more to this. You were right. I'm Dr. Naresh Hirani. I've been a dentist for nearly 25 years, and I specialize in helping people whose teeth are failing. I find solutions that are not removable and certainly not plastic. I see patients every single week who were told dentures were their only option, and they weren't. In this video, I'm going to share 5 truths about dentures that no one's telling you. And by the end, you'll understand why settling for a denture without exploring your options could be one of the most costly decisions you ever make. Point 1, dentures actively destroy your jawbone, and your dentist may not have mentioned that. Here's what most people are never told. The moment your teeth come out of your jawbone, it starts shrinking. Your body sees the bone as no longer needed and begins to resorb it. A denture sits on top of that shrinking jawbone. It never stays still. It rocks, it rubs, it loosens, and the bone, well, that keeps disappearing year after year. And this is the part that should stop you. Dentures don't just replace teeth, they accelerate the loss of bone underneath. I see patients who've worn dentures for 10, 15 years, and the change in their face is unmistakable. The jaw shrinks, the lips collapse inwards, the face shortens, and the denture itself has nothing stable to sit on anymore. No one warned them. Think of it like this. If you put your arm in a sling for a year, the muscle naturally wastes away. Your jawbone pretty much works in the same way. No teeth, no stimulation, and your body starts taking it back. Dentures don't stop that. Implants do. If you're considering a denture, ask this: what will my jawbone look like in 10 years' time? If you're not told smaller and weaker, you're not getting the full picture. And bone loss, that's just the beginning. Point 2, you'll never eat the way you used to, and that's fact, and nobody warned you. Dentures restore about 25% of your chewing power. Natural teeth, well, natural healthy teeth being 100%. Implants are close to 90%. That's not a small gap. That's the difference between eating a steak and eating mashed potato. Patients with dentures stop eating apples, nuts, raw vegetables, crusty bread. They're basically adapting. That's not the same as living well. Let me say this plainly. A denture is not a replacement for teeth. It's a compromise pretending to be one. I hear this constantly. I haven't been eating properly in years. And then they list what they've given up: steak, salads, sandwiches, apples. Their world shrinks to soft foods. It's like being given a pair of plastic shoes and being told they're the same as leather ones. They might look similar, but try walking in them. Dentures look like teeth. They don't function like teeth. Do this right now. Make a list of foods you've stopped eating. If it's more than 5, you're already paying the price of quality of life. And the emotional cost, that's often even bigger. If this is the first time someone's actually told you the truth about dentures, hit subscribe. I release videos every week to help you make decisions you won't regret later. Point 3, you may be a far better candidate for implants than you've ever been told. One of the biggest reasons people get pushed towards dentures is this: you don't have enough bone, you're too old, your case is too complex. In 2026, those reasons really hold up the way they used to. Modern implants, bone grafting, full arch solutions can handle cases that were impossible 15 years ago. And here's the truth: you're not a candidate often means I'm not the dentist who can do this. I've treated countless patients who were told implants weren't possible. Then we did a proper 3D scan, planned it digitally, and within months, they've had fixed teeth. No denture. Ask yourself this: were you told no without a 3D scan? Were alternatives properly explained? Does your dentist actually place complex implants? If any answer is yes, you need a second opinion. Point 4, you're not too old and it's not too late. I hear this all the time. I'm too old. It's too late. Neither's true. Age isn't the deciding factor. Health is. And most people in their 60s, 70s, even 80s are suitable. I've placed implants in patients in their 80s, even one in their 90s, who went on to enjoy years of confident eating and smiling. Let me say this clearly. Patients who say, I wish I'd done it sooner, outnumber the ones who regret it by 100 to 1. If you think you're too old, stop guessing. Ask, am I medically suitable for implants? Let a proper assessment answer that. Point 5, a denture should be the last result, not the default. Most people end up with dentures not because it's the best option, but because they weren't given the full picture. A proper consultation should explain every option, every pro, and every con in a language you actually understand, not dental jargon. If you feel rushed or unclear, that conversation was incomplete. Think about it like this. If you need knee surgery and someone said, let's just amputate, you'd get a second opinion, wouldn't you? Your teeth deserve the same respect. Here's your test tonight. Write down 3 things what you were told about dentures. What other options were offered? Did you fully understand everything before being asked to decide? If the answer is no, you don't have to accept that plan. Book a consultation with someone who specializes in implants. Get a 3D scan, ask every question, take control of the decision. Dentures are not your only option. They're not always the best option, and in many cases, they're nowhere near the right option. You deserve to know what's actually possible before anything permanent is done. If you're wondering whether your teeth are already heading towards failure, watch this video next. I break down the 5 warning signs and exactly what to do next. It's on the screen now. Click on it and I'll see you there.